causing skin ulcers and life-threatening illnesses. How is leishmaniasis treated? Pills you swallow, cream or lotion that you apply to your skin, liquids that your provider give you in an IV catheter which goes through vein. Medications provider used to treat leishmaniasis include amphotericin, miltefosine, pentavalent antimonials such as sodium stibogluconate, paramomycin. Leprosy. Leprosy, also known as Hansen's disease, is a long-term infection by the bacteria Mycobacterium leprae or Mycobacterium lepromatosis. Infection can lead to damage of the nerves, respiratory tract, skin, and eye. Treatment: anti-leprosy medication, skin changes. Leprosy is spread between people, although extensive contact is necessary. Leprosy has a low pathogenicity, and 95% of people who contract it leprae do not develop the disease. Spread is thought to occur through a cough or contact with fluid from the nose of a person infected by leprosy. Leptospirosis. Leptospirosis is a rare bacterial infection we get from animals. It spread through their urine, especially from dogs, rodents, and farm animals. They may not have any symptoms, but they can be carriers. What causes it? Leptospirosis is caused by a bacterium called Leptospira endogens. The organism is carried by many animals and lives in their kidneys. It ends up in soil and water through their urine. How is leptospirosis treated? Your healthcare provider will treat leptospirosis with antibiotics. If you have a mild case, they may have you keep an eye on your symptoms to see if you get better without treatment. What medication and procedure are used to treat leptospirosis? Antibiotics, mechanical ventilation, plasmapheresis. Lymphatic filariasis. Lymphatic filariasis is a human disease caused by parasitic worms known as filarial worms, usually acquired in childhood. It is a leading cause of permanent disability worldwide. Doxycycline kills these bacteria, which in turn prevent the maturation of microfilaria into adults. It also shortens the lifespan of the adult worms, causing them to die within 1 to 2 years instead of their normal 10 to 14 years lifespan. Doxycycline is effective in treating lymphatic filariasis. Limitation of this antibiotic protocol include that it requires 4 to 6 weeks of treatment rather than the single dose of the anthelmintic agents. That doxycycline should not be used in young children and pregnant women, and that it is phototoxic. Surgical treatment may be helpful in cases of scrotal elephantiasis and hydrocele. However, surgery is generally ineffective and correcting elephantiasis of the limbs. Malaria. Malaria is an acute febrile illness caused by Plasmodium parasite, which are spread to people through the bites of infected female Anopheles mosquitoes. It is preventable and curable. Malaria is a treatable disease. Artemisinin-based combination therapies are the most effective antimalarial medicines available today and the mainstay of recommended treatment for Plasmodium falciparum malaria, the deadliest malaria parasite globally. In humans, malaria parasites grow and multiply first in the liver cell and then exponentially in the red blood cells. It is the blood stage of the parasite life cycle that causes the symptom of malaria in humans. Measles. Measles is a highly contagious, vaccine-preventable infection disease caused by measles virus. Symptoms usually develop 10 to 12 days after exposure to an infected person and last 7 to 10 days. Initial symptoms typically include fever, often greater than 40 degrees Celsius, cough, runny nose, and inflamed eyes. Small white spots, known as Koplik spots, may form inside the mouth 2 or 3 days after the start of symptoms. Measles can lead to serious problems if it spread to other part of the body, such as lungs or brain. Doctors give vitamin A to children with measles because vitamin A has been shown to reduce the number of deaths and serious disease resulting from measles in countries where vitamin A deficiency is common. Children with measles are kept warm and comfortable. Acetaminophen or ibuprofen may be given to reduce fever. Meningitis. Meningitis is an infection and inflammation of the fluid and membranes surrounding the brain and spinal cord. These membranes are called meningitis. The inflammation from meningitis typically triggers symptoms such as headache, fever, and a stiff neck. Meningitis treatment depends on the cause. Antibiotics are used to treat bacterial meningitis, and antifungals are used to treat fungal meningitis. Antiviral can be used to treat some viral causes of meningitis. Non infectious causes of meningitis are treated by addressing the underlying illness or injury. Pertussis. Pertussis is a highly communicable disease occurring mostly in children and adolescents and caused by the gram-negative bacteria Botrytis pertussis. Transmission is mainly via droplets of respiratory secretion that contain B. Pertussis from infected patient, particularly during the catarrhal and early paroxysmal stages. Antibiotics given during the catarrhal stage may ameliorate the disease. After paroxysms are established, antibiotics usually have no clinical effect but are recommended to limit spread. Preferred drugs are erythromycin 10 to 12.5 mg per kilogram orally every 6 hours. Azithromycin 10 to 12 mg per kilogram orally once a day for 5 days. Poliomyelitis. Poliomyelitis does not affect any species other than humans. The disease is caused by infection with a member of the genus Enterovirus known as poliovirus. Polio occurs naturally only in humans. It is highly infectious and is spread from person to person, either through fecal oral transmission. There is no cure for polio, but there are treatments. The focus of modern treatment has been on providing relief of symptoms, speeding recovery, and preventing complications. Supportive measures include antibiotics to prevent infections in weakened muscles, analgesics for pain, moderate exercise, and a nutritious diet. Treatment of polio often requires long term rehabilitation, including occupational therapy, physical therapy, braces, corrective surgery, and, in some cases, orthopedic surgery. Rabies. Rabies is caused by a number of lyssaviruses, including the rabies virus and Australian bat lyssavirus. Duvenhage lyssavirus may cause a rabies-like infection. Treatment of the wound. Prolonged cleansing of the wound or contact site for 15 minutes to eliminate the virus as soon as possible after exposure is of critical importance. For skin, use soap, rinse copiously with running water, remove all foreign material. Application of a disinfection is an additional precaution which does not take the place of through wound washing. For mucous membranes, rinse thoroughly with water or sodium chloride. Local cleansing is indicated even if the patient presents late. Tetanus. The bacterium that causes tetanus is called Clostridium tetani. The bacterium can survive in a dormant state in soil and animal feces. It's essentially shut down until it discovers a place to thrive. When the dormant bacteria enter a wound, a condition good for growth, the cells are awakened. As they are growing and dividing, they release a toxin called tetanus plasmin. The toxin impairs the nerves in the body that control muscles. Mild cases of tetanus can be treated with tetanus immunoglobulin, antibiotic therapy to reduce toxin production. Metronidazole intravenous is a preferred treatment. Benzodiazepines can be used to control muscle spasms. Options include diazepam and lorazepam, oral or IV. Tuberculosis. Tuberculosis is a serious illness that mainly affects the lungs. The germs that cause tuberculosis are a type of bacteria. Tuberculosis is caused by a bacterium called Mycobacterium tuberculosis. Treatment of TB uses antibiotics to kill the bacteria. Tuberculosis can spread when a person with the illness coughs, sneezes, or sings. This can put tiny droplets with the germs into the air. Another person can then breathe in the droplets and the germs into the lungs. Typhoid fever. Typhoid fever, also known as typhoid, is a disease caused by Salmonella serotype typhoid bacteria. Symptoms vary from mild to severe and usually begin 6 to 30 days after exposure. Often there is a gradual onset of a high fever over several days. This is commonly accompanied by weakness, abdominal pain, constipation, headache, and mild vomiting. Some people develop a skin rash with rose colored spots. Treatment: oral rehydration therapy, antibiotics, surgery, resistance. Thank you for watching our video. Check the I button above for new release of next part. Subscribing our channel, stay tuned.